afternoon, everybody. This is Congressman Mike Levin. Thank you again for watching another of our virtual town halls on the coronavirus. I hope everyone is doing well and staying safe and healthy during this very difficult time for our community and for our country. Whether you're watching us on Facebook or Twitter or YouTube or on our website, we're very grateful that you're here. As always, we've got a fantastic local expert, Dr. Richard Garfien, infectious disease epidemiologist from UC San Diego. He is an educator and a healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. Dr. Garfien earned his PhD at Johns Hopkins University and MPH at San Diego State University. He served as an epidemic intelligence service officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention in Atlanta, Georgia, before joining the UC San Diego School of Medicine faculty in 2005. Dr. Garfien's research focuses primarily on airborne and bloodborne infections, often associated with health disparities in substance use, including tuberculosis, HIV, and viral hepatitis in the US and abroad. His research on digital adherence technology over the last decade informed CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Such technology has great relevance today for COVID-19 monitoring and patient support. Dr. Garfien, thank you as always for joining us.
You're welcome. It's great to be here again.
Well, over the next 90 minutes, we're going to share the latest public health and safety and policy information with all of our viewers today. And we're going to let you know about the latest actions we're taking in Congress, and we're going to take a lot of your questions as well. To ask a question, please comment on the live stream or email us at townhallquestions@mikelevin.org. That email address again is townhallquestions@mikelevin.org. We've had a number of questions over the week that we will get to, and please send those along and we'll get to them in the order received as quickly as we can. Earlier today, I was honored to host another virtual event for our frontline workers, and we're so very grateful for them. We were joined by many of our local elected officials and the frontline workers themselves. And I was reminded of a quote by Elie Wiesel, who said, "Just as despair can come to one only from other human beings, hope too can be given to one only by other human beings." The stories of kindness and compassion that we heard today from our frontline workers, of our communities coming together during these unprecedented challenges to help one another, even in the simplest ways, gives me hope, and I hope us all hope, that we're going to get through this together and maybe appreciate each other a little bit more along the way. And while things are slowly getting better, make no mistake, the numbers this past week continue to be tragic. We now have over 65,000 Americans who have died as a result of coronavirus, and we're all shaken by that statistic, prayerful for the families that are affected. In total, the United States, as you know, has the most confirmed cases of coronavirus in the world, with 1,117,979, with again 65,416 deaths. The state of California has confirmed 52,295 cases with 2,135 deaths. San Diego County has confirmed 3,711 cases with 134 deaths. Orange County has confirmed 2,537 cases with 50 deaths. The California Department of Public Health continues to believe the peak date in California will be sometime in mid-May. And I speak every day with public health leaders in both counties. And while the situation is improving, there are still things that we need to do. I understand everyone's frustration with the stay-at-home orders, with closed businesses, closed public spaces. We need to get back to normal as quickly and as safely as we possibly can. That means listening to the experts. It means following the public health recommendations. And it means expanding testing capacity significantly. The sooner we do those things, the sooner we can reopen. That's what I'm focused on. In terms of how much testing is needed, according to Harvard University, we should be administering a minimum of 152 tests per day per 100,000 residents to be able to collect the data needed to detect whether the virus is spreading and who has contracted it. Also, infected people need to be identified as much as possible, and those who are infected must isolate in order to keep our economy open as much as possible. You hear a lot about testing tracing, treatment, isolation. So how are we doing? Well, in San Diego and Orange counties, what we need to be doing, again, for that 152 per 100,000 per day, it would mean that we need somewhere on the order of 5,000 to 5,200 tests per day in each county. San Diego has been averaging a little over half that, around 2,500 to 3,000 tests per day. Orange County has been somewhere at around 1,500 per day. So we're making progress, but we still have a ways to go before we have the tests that we need. As I've said many times, we're facing two simultaneous crises in our country, a public health crisis and an economic crisis. And in order to fully solve the economic crisis, we've got to fully solve the public health crisis. We can't have a healthy economy without healthy people. And that's what we've tried to do in the Congress. Now, with 4 bills from the beginning of March all through just last week, first with $8 billion for the vaccine, then with $200 billion for emergency sick leave and for our frontline medical professionals, expanded nutrition assistance, expanded Medicaid funding. The third bill, the CARES Act, of course, $2 trillion, $150 billion for state and local government, $100 billion for our hospitals, $16 billion for the Strategic National Stockpile for PPE and ventilators and the rest, $20 billion for our veterans, mostly for the Veterans Health Administration, and $31 billion for our education, for K through 12 and for higher education, including $44 million that came to the 49th District to UC San Diego, Maricosta, and Saddleback College. Then for our workers and their families, expanded unemployment insurance, $600 extra a week for 4 months, bringing the maximum you can get in unemployment benefits in California from $1,800 up to $4,200 a month. In addition, this past week, California EDD made available the pandemic unemployment assistance funds for those who are 1099 independent contractors or gig economy workers to be able to go and get unemployment insurance benefits as well. Second, direct cash payments. Most of you hopefully have gotten your direct cash payments already, and you either got them via direct deposit or perhaps some have begun receiving checks. But that's up to $1,200 per person, up to $500 per dependent, and for now is a one-time check. And then lastly, the Paycheck Protection Program. Initially $350 billion for our small businesses, forgivable loans of up to $10 million to be used for up to 8 weeks of payroll, overhead, expenses, and the rest. Just like you, I was very frustrated to read of stories like the Los Angeles Lakers, and I grew up a Lakers fan, by the way, so I'm not picking on the Lakers, but to see the Lakers get millions of dollars and Shake Shack and Ruth's Chris Steakhouse and Potbelly sandwiches, nothing wrong with any of those businesses, but that wasn't who we intended for the Paycheck Protection Funds to go to. We wanted them to go to mom and pop businesses. So we then came back and we did an interim bill, which you could call Bill 3.5. And that was an extension of the CARES Act. It included an additional $320 billion for the Paycheck Protection Fund. However, $60 billion set aside for small and community-based lending to actually go to our small businesses, our small nonprofit organizations. So I'm encouraged by that. That money is now out there being lent to our business community. And for those that have questions or concerns, please contact our office if you have any issues at all. We've got great in-house resources, and we'd love to be of assistance. The other thing that our interim legislation did from last week, another $75 billion for our hospitals. I have been advocating for far more money for our community health centers. They're largely funded through Medicaid rather than Medicare. They were largely left out of the last CARES Act. Then finally, $25 billion for testing. A national testing strategy is required under the interim legislation, and that national testing strategy has to be made available to the Congress by May 24th, and it has to include both antibody testing and standard diagnostic testing. We know that we had early problems with the testing. When you look at per capita, how many people we tested versus many of the peer nations, we know that we were behind because of early problems that have been well documented at both CDC and FDA. We're now playing catch up. We've got a lot more catch up before we hit that 152 tests per 100,000 people per day that we need. We've given the funds to the relevant agencies. Now they've got to come through and deliver. And in particular, our state and local governments need help from the federal government with regard to the supply chain for things like swabs, for things like the reagents, the chemical compounds needed to make the tests work properly. This past week, we also made progress by creating the Select Committee on the Coronavirus Crisis, the purpose of which is to ensure oversight of the nearly $3 trillion and counting that the federal government has spent on COVID-19 to date. I'm also very pleased that this past week, the Senate passed our Student Veteran Coronavirus Response Act, which follows a related bill we passed earlier to ensure that student veterans will not see a reduction in their monthly housing allowance or other benefit as a result of the schools closing because of COVID-19, either closing altogether or going to distance learning. We had to make those needed changes to the GI Bill, and I'm very happy we were able to work in a bipartisan way very quickly to get that done. So what comes next? Well, in the weeks ahead, it should be everyone's priority in our government to help our heroes on the front lines, those most in need, regardless of what state or city they're in. We're the United States of America, and we ought to be united in this fight. That's why, as part of the next bill that we're calling CARES 2, the sequel to CARES 1, we need a lot more funding for our state and local government, including a specific stabilization fund for cities that are smaller than 500,000 people that were left out of CARES 1. We also need far more funding for education, including K through 12 and higher ed. We need additional funding to secure our elections and protect the vote. I have supported national vote by mail before COVID-19. I think it's even more important now, given what we've seen recently in Wisconsin, where you had people literally choosing between voting and staying healthy. We should never allow that to happen again. We also need to protect the United States Postal Service, which is anticipating a significant loss of revenue due to COVID-19. The USPS, which was scheduled to have liquidity issues in 2021 before all of this, and we've got to do everything we can to stabilize USPS. And of particular importance to me, given that I chair the Veterans Affairs Subcommittee on Economic Opportunity, is that over 100,000 veterans work at the USPS. We also need, in general, hazard pay for our frontline workers and those in harm's way, OSHA protections for safety in the workplace, expanded family and medical leave, increased nutrition assistance, full funding for COBRA, and a special enrollment period for those without health insurance under the Affordable Care Act. We've got to fight for all of those things, and I believe we also must discuss on an as-needed basis, as we see the duration of this crisis and the toll that it's taking on our workers and their families, expanded unemployment insurance on a longer basis, and perhaps additional direct cash payments until things get back to moving in a positive direction again. We're also going to need a big, bold jobs program to get millions of Americans back to work. In particular, I'd like to see investments in infrastructure, including broadband access. Over 21 million Americans still don't have access to broadband. Makes it pretty tough to study from home or work from home if you don't have access to broadband. We've got to improve our water systems. We've got to improve our electric grid. We've seen 30 million jobs lost in the last 6 weeks, and we're going to need to be thinking strategically and very boldly about how we can put millions of Americans back to work. And I think infrastructure makes a huge amount of sense given its long-term economic benefit. And specifically, I've spoken with our mayors, our city managers, and many community leaders about the shovel-ready infrastructure projects in the 49th, and I'll be fighting for those. I'm also working with my friend, Republican Rodney Davis of Illinois, to include our Prevent Family Fire Act as part of CARES 2. That legislation would provide a tax credit for safe storage devices of firearms. We know that if firearms are in the home and they are locked and safely stored, the risk of accident goes down by 74%. So I'm very honored to be working with Rodney and with the Brady campaign and others on that bipartisan legislation. I've been very saddened to hear stories of increased domestic violence during COVID-19, and I encourage anyone in need to call or text the National Domestic Violence Hotline at 1-800-799-SAFE. That number again, 1-800-799-SAFE. With that, I'll turn it over to my friend, Dr. Garfien, for an opening statement, after which we'll get to your excellent questions. Dr. Garfien.
All right. Thank you, Congressman. So lots been going on this week. For one, there's been several protests this past week over easing of restrictions, and pictures have been on the news and the newspaper showing protesters and their kids standing close together and not wearing masks. These protesters are understandably have a lot of frustration over the delays in reopening businesses, letting their kids go back to playing in the playgrounds, going to the beach, traveling, etc. But I have to say, I was disheartened to see that some of the protesters had signs reading things like "science is fake news," because when people stop trusting science, then all we have left are opinions and politics. And I don't think that's what we need in this situation. But not wearing masks is in public is reckless, and that's because they're potentially exposing themselves and others to the virus, including the many children that were present at these protests. Also, when you're shouting, it projects your voice, which also expels the virus much further. And so not only are you standing in a crowd, but also you're projecting your voice, which could actually spread more virus more quickly to the people around you. So what we need to remember is that while masks may provide some protection for the wearer, the main reason that we're wearing masks in public right now is to avoid spreading the virus to others, especially when people are infected and don't know they have symptoms yet. So once we start interacting again and going back to work, church, business, and all the things that we want to be doing again, it's going to be impossible for us to stay 6 feet away from each other, what we're calling social distancing. So this is going to become a critical time for us to be wearing masks in public to avoid when we can't avoid that physical distance between us and we are coming together. I was just at the beach this week, and the staircase to get down to the beach is narrow, and if you've got a lot of people coming and going, it's impossible to avoid coming in contact with people closely. So we really have to think about how we're going to be doing this as we move forward. The other thing I want to mention is that we're starting to enter into the next phase of the epidemic. So far, our region has done a really good job of flattening the curve, the epidemic curve. And my colleagues that are working at UCSD in the hospital say that they're managing the number of COVID patients really well, and most of the patients are surviving. So that's excellent news, and that says a lot about our ability to not overwhelm the system by keeping the number of cases down. So the stabilization is what they needed in order to decide when it's time to start seeing patients back in the clinics for non-urgent care and for elective procedures. And those plans are being made right now. And I think that's really important for people that have been postponing their medical visits. But although the number of new cases the increase in the number of new cases has stopped and it's plateauing out, we still are at a high number of new cases every day. So we're not out of the woods yet. In fact, we're actually entering what I call the next phase of the epidemic, in which as the restrictions are being lifted, we need to be constantly vigilant to ensure that we don't go too far and have the number of cases start to rise again too quickly and then overwhelm the healthcare system. So in this phase, what we need to be doing is what's called contact tracing. And this is where the health department will identify infected individuals and contact everyone that they've encountered during the period while they were infectious. The contacts are then informed that they could have been infected and that they should self-quarantine for 14 days to allow the virus to allow for the disease to occur, and then for the symptoms to develop and to find out if they test positive. If they don't test positive or develop symptoms within that 14 days, then they can go back to being in public. But during that period of time, it's really important that they don't expose others. Also, any contacts who are found to be infected should stay in isolation until they fully recover from COVID-19, and their contacts should be notified to self-quarantine as well. So this is going to be no easy task. Just think about the number of people that you come in contact with within 6 feet in the past 2 weeks. That's kind of what we're asking people to remember. So the fewer people you come in contact with, the easier it's going to be if you do find out that you are a contact, and you've got to remember everybody that you've been in contact with. The good news is that the governor has just approved funding to hire 10,000 contact tracers throughout the state. The number of staff that will be hired to do contact tracing in San Diego and Orange counties is still being worked out, and the protocols are also being developed so that we can start that process soon. So I'm really happy to see that we're at this phase. It shows us that we're moving through the epidemic. We're on to the point where we're starting to think about getting back into public and interacting, but that means we need to be hyper vigilant to make sure that we know when cases are occurring and to respond appropriately. So it's exciting to see movement, change. We're in for some interesting times, but I think if we're all diligent about protecting each other, I think we can prevent a real disaster from happening.
Thank you so much, Dr. Garfien. Really appreciate that. And you brought up masks in public, and I have to give a shout out to my friend Louise Herbert, who has now made 4,058 masks. She has a group that's made, and including this one right here. And I wore this one on the airplane, and then I came back and I washed it like you told me to.
Good job.
So there you go.
Well, my wife has made about 7 so far this week, and I can say that making 4,000 would just be a monumental task.
She's probably making them right now while watching this.
Kudos to her.
Would be my guess, knowing her. But truly amazing. And, you know, it's the stories about everyday people showing that incredible generosity and kindness, going above and beyond. That really give me reassurance that we're going to get through this and we're going to be stronger when all this is over. So lots of questions, and there's a good split between policy questions and medical questions. First one is from Colleen in Carlsbad. She asked, what is being done to provide financial support to essential workers, such as hazard pay? This extends to grocery store workers, gas station workers, etc. These people are on the front lines with no training and no support, and they aren't even receiving tangible benefits for this public service. Colleen, you're absolutely right. I agree 100%. And beyond just showing our appreciation by doing events and things like that, this past week we had a letter that was sent by more than 150 members of Congress, including myself, to Speaker Pelosi and to Minority Leader McCarthy, requesting the inclusion of several different proposals that seek to prevent frontline workers from being placed in any unnecessary harm during this crisis. Calls on OSHA to establish an emergency temporary standard, hazard pay, paid sick leave, expanded telework support, many other policies to protect our frontline workers. They cover healthcare providers, support personnel, throughout the federal government, from the Veterans Affairs Department to FEMA, transportation security officers, food safety inspectors, and a variety of others at DOD and Homeland Security. So my great hope is all of that will be included as part of CARES 2, and the Speaker has started calling it the HEROES Bill, referring to those heroes on the front lines. So hopefully that will all be included. Here are 2 questions for Dr. Garfien. The first is from Lori in San Clemente. Lori asks, do we have any idea why there is so much variation in responses to the virus from no symptoms to severe to death? It seems there is more to this than age and underlying conditions. And a similar question from Janet in San Juan Capistrano. Is there a reason why some patients do not show symptoms? Is it because they are younger or more fit?
Well, these are great questions. So just to sort of remind everybody, the most common symptoms for coronavirus include cough, fever, shortness of breath, muscle aches, sore throats, diarrhea, headaches, sometimes fatigue. And an interesting one is the unexplained loss of taste or smell. And that's actually not totally uncommon. It does occur with people during a common cold, but it seems to be more pronounced with this particular coronavirus. And so these are all really common symptoms, and a lot of things can cause them, including allergies and, you know, common cold or the flu. And so the range of symptoms that people experience is quite variable. The severity of the symptoms can range from, you know, going from non-existent to life-threatening. And while approximately 20% of the COVID cases may require hospitalization, fortunately, the majority of people can recover at home. The reason for the difference in the severity of illness between cases is unclear. And that's because, and there is ongoing research to identify differences between those with severe versus mild illness and asymptomatic disease. Some of the factors that have been identified so far are commonly known as older age, so age over 65, obesity, immunosuppression, whether that's due to a disease or medications being taken to treat a disease, also underlying diseases of the lungs, the heart, the liver, and the kidneys. There's been some research that's actively underway to determine if a deficiency in a receptor called the ACE2 receptor that's found on the surface of cells in the lungs and other organs can lead to some protection. It's believed that that's the target for the virus, and if people have fewer of those receptors on their cells in the lungs, then there's less cells that can be infected, and that might lead to less infection. And there's some potential hope that that knowledge may lead to some potential treatments for the disease. There's also been some studies that have shown that blood type, like type O blood and Rh factor protein, appear to be associated with lower risk of infection. However, these were correlational studies. We call them cross-sectional studies, which can tell you that there's an association, but they don't tell you whether or not it's causal and that those factors really are protective. Also, there's many other variables that could affect the likelihood that somebody will have severe symptoms. And these could include genetic factors, the amount of virus that was transmitted at the time of the initial infection, the anatomy of somebody's lungs and respiratory tract, any underlying illness or temporal factors that might affect one's immune system, such as are they getting enough sleep, are they stressed out, are they eating properly. However, all these things are somewhat speculative right now. There's no definitive answers. Some of these issues are being studied. But you could just sort of imagine with any disease, or every disease I can even think of, all of them have a range of severity. You know, there isn't a disease out there that I think is either you have it or you don't, and everybody's the same. So I think this is not unique in that many people have asymptomatic disease and other people have serious disease. But studies are being done now to try to sort of understand what those factors are that are associated with severity. One, so that we can predict who's more likely to be in trouble if they get sick. And the other is because it might give us some clues to how we can better treat it or prevent it.
Thank you so much for that. So follow-up question, just from my own curiosity. We hear stories of younger and healthier people that are still getting this and still getting really, really sick. Do we have any idea why that might be? Are they just being exposed to more of the virus, perhaps? Or is it something else that we're not quite understanding?
Yeah, I think I talked about this on another call where looking at the amount of virus, seems like it's not really related to the level of disease because the virus replicates so fast. It only takes a couple virions to cause an infection. So it's unlikely for that, but it's uncertain as to why some young people get sicker than others. It could be something in genetic, it could be something in some underlying disease that wasn't recognized before, or it could just be that they're unlucky and the virus happens to be more aggressive when it gets into those people than others. Yeah.
Got it. Okay. Thank you. Patricia in Oceanside asks, why is the U.S. shipping masks, PPE, and other equipment to Russia when we don't have enough here in the U.S.? Well, Patricia, I haven't heard anything about us shipping PPE to Russia. I'm certainly aware of other stories about early on, January, February timeframe, we shipped certain things to China. I have read about that. Look, I am incredibly frustrated by the lack of transparency and accountability on the part of FEMA as it pertains to PPE and critical supplies not getting to our frontline medical professionals in the states that need them and the cities that need them. And I wrote a letter along with many of my colleagues to FEMA. And I've written again to Vice President Pence and Secretary Azar, trying to get to the bottom of it, because it's absolutely unacceptable that in our country that we would have frontline medical professionals that don't have basic personal protective equipment. And it's not something we can ever allow to happen in this country. So I will do everything I can as a member of Congress. Certainly, we've sent enough money to the respective agencies, tens of billions of dollars over a number of months. It's certainly not for lack of funds. I do know that a lot of those supplies are being manufactured overseas. I would absolutely like the president to use the Defense Production Act more aggressively than he has been with regard to PPE, and we will stay on it. But I appreciate the question. Mary in Oceanside asks, I am concerned about the origins of the COVID-19 virus and the ramifications of the huge amount of money being spent to fight the virus. We need to take action to ensure that this doesn't happen again. Can you tell me if the federal government is investigating the source of the virus? Yes, the federal government has been, and I know continues to be, researching the source of the virus. I know that there is a fair amount of misinformation out there. We've been briefed on this as members of Congress a number of times, and we've asked as members of Congress for months now whether or not there's any evidence to suggest that COVID-19 was developed in a lab somewhere. And the answer has always been unequivocally no, that it's always been felt that this is a naturally derived virus, which, came from contact with infected animals. But I am not an expert. We happen to have one here, though, and perhaps you could you could comment on the origins of all of this.
I'd rather not.
Okay.
I've heard about a lot of the conspiracies, and frankly, I don't care at this point. We've got to deal with it. Maybe down the road we could figure it out, and if it turns out it's China, we can deduct some of what we owe them for the loss of our economic losses. But at this point, it doesn't matter to me. We're dealing.
Fair enough. Fair enough. I can tell you that point blank, we've asked at hearing after hearing of our public health experts, is there any evidence that this was caused by humans in a lab trying to create, some sort of bioterrorism? And unequivocally, time and again, the answer has been no. And so we'll keep asking, but I think the widely accepted belief is that it was created through contact with infected animals. And as you said, Doctor, at the end of the day, we're going to have to deal with it no matter what. Here's a question for you from Lisa in Carlsbad. Can you please speak to recent criticisms about disinfectants found in traditional vaccines?
Sure. So I think that by disinfectants, what Lisa might be referring to are some of the other materials that are added to vaccines when they're produced. So vaccines contain the proteins that are designed to stimulate the immune system to make antibodies to the disease that you're concerned about. But in addition, some vaccines contain preservatives to make sure that they have a good shelf life. They also contain something called adjuvants, which are safe chemicals that are added to the vaccine to actually ramp up the immune system and have a stronger response. So you need to add less proteins in order to get a good immune response so that the vaccine actually will have a good long-term response. And then there can be some residual materials that are left over in the manufacturing process. And these include things like egg proteins or yeast proteins or human albumin. It sort of depends on what the pathogen is that they're making the vaccine against. These things have been studied to death. There have been multiple studies that have looked at whether any of these components can cause harm to infants and children and adults. Things like thimerosal, which used to be put in vaccines as a preservative, they contain trace amounts of mercury, and that's always really frightening people. But those have been removed as of 2001 from childhood vaccines. Aluminum, gelatin, human albumin, formaldehyde, these are other things that might be found. Of those, the only things that have been found to cause problems are gelatin and egg proteins, which can cause an allergic reaction. So somebody can go into anaphylaxis, and that's why the doctors always want to keep the patient in the clinic for a few minutes after they give the vaccine to make sure that they don't have a reaction. And they'll also ask, are you allergic to eggs, and before they'll give you the vaccine. But all those other items that I mentioned, none of them have been found to be harmful in the quantities that they're in vaccines in both humans and in experimental animals. So when it comes to the anti-vaxxers and their concern, I think that there really isn't much to be concerned with these vaccines. And in fact, what's interesting is that there might be some good news coming out of the coronavirus pandemic, which is that people who have been opposed to vaccines in the past are kind of taking a different position on the COVID vaccine. And so it's easy to see how parents who have never seen a rare disease before, like mumps or measles or rubella, would say, why would I want to take even a very slight chance of a risk of vaccinating my child when I've never even seen this disease before? But now that we've got a disease that's infected over 1 million people in the United States and killed over 50,000, I think it's starting to hit home, and people are starting to say, you know what, maybe it's worth that little risk to my child to make sure that they're not getting infected and dying or exposing somebody else in the family that could die from it.
Thank you for that answer, Doctor. Kathy in Encinitas and Dennis in San Clemente both asked very similar questions. What can the federal government do to make more testing for COVID-19 and the antibody testing available to all that want to be tested? Well, Kathy and Dennis, this is something that I have been focused on for weeks now. We know the early issues with both CDC and FDA with regard to our testing in January, February, and in most of March. We also know that to this day, we're not testing nearly enough people. Again, the Harvard University metric is 152 per 100,000 per day that need to be tested across the United States. We currently in California are well under that. We're doing better in San Diego County and reasonably well in Orange County, but we still have a long way to go. As I said before, the federal government can play a very important role in helping to manage the supply chain because there are certain components of our tests, like swabs and like reagents, that are difficult to source, and the federal government could play a very constructive role. In the last bill, as I mentioned, there was a specific provision requiring the federal government to develop the national testing standard for both standard diagnostic testing and antibody testing and present that to the relevant committees in Congress by May 24th, 30 days after the legislation was in effect. So we're all waiting to see what that's going to look like. I wrote Vice President Pence and Secretary Azar and was joined by many of my colleagues on that letter, demanding that the testing strategy be specific, be robust, and really have what is needed in order to advance towards those goals that we're going to need to achieve to give public confidence in reopening our businesses, our public spaces, and all the rest. With regard to the antibody testing, I have read reports that perhaps just as FDA was too slow to offer EUA emergency use authorization to commercial and clinical labs when the pandemic started, they might be moving too fast with regard to some of these antibody tests. We want to make sure that there's a balance there and that the antibody tests that are approved for emergency use authorization actually work and are effective. So we'll be watching this very closely. I know my colleagues are very eager to hold hearings and to bring people like Dr. Fauci in to discuss this. Very disappointed that the administration has made the decision not to allow Dr. Fauci to testify before the House. They let him testify before the Senate, but not the House, which leads to the conclusion that it really is political. And I think everybody would acknowledge that we all have nothing but the highest degree of respect and admiration for Dr. Fauci, and we'd be asking tough questions, and he would be, as he always does, telling the truth. And I think he should be allowed to testify. But I could go on and on about this, but I'm sure it'll be a hot topic in the weeks ahead. Here's a question for Dr. Garfien from Glenn in Carlsbad. How does mutation of the COVID-19 virus affect the efficacy of vaccines that are under development? Is it possible that by the time a vaccine becomes available, strains of the virus will have developed that the vaccine does not create an immune response? Do you think the reports that some people who have recovered from COVID-19 have later tested positive might tell us that developing an effective vaccine may be especially challenging? Really excellent question, Doctor.
Yeah, yeah, it's really important too. Yeah, vaccine production is really a top priority, not just here, but around the world. So there's many top scientists that are working on this. And the good news is vaccines have been used to combat the spread of viruses for centuries now. And so scientists have a vast amount of accumulated knowledge to work from. So this isn't new to them. And viral mutations is not something that they haven't dealt with before. And the way that that's handled is by looking for multiple targets on a virus and then designing vaccines that target the parts of the virus that tend to mutate slowly. So different parts of different viruses tend to be more conserved and they don't change very much, and other parts have a tendency to change more. And so they look to make vaccines that target the more conserved parts of the virus that are less likely to mutate. And then so for example, like the targets on the influenza virus, they tend to mutate rapidly, which is why we have to have a new vaccine made every year for the flu vaccine. But researchers from Yale recently who are working on the vaccine have reported that the sequences in the original isolates from China seem to be very close to those that are currently circulating here in the US and the rest of the world. So if there was a lot of mutation happening with this coronavirus, we would have been seeing it already. And unfortunately, it doesn't look like it's mutating that quickly. Also, there's other examples of other RNA viruses, which is what coronavirus is, such as the mumps virus. And we've been using that same vaccine for over 45 years, and it hasn't changed. So we're hopeful that a strong vaccine can be made, and we don't have to worry too much about it mutating. But notably, vaccine development in the United States used to take about 3 to 5 years, but now vaccines can be produced in about 12 to 18 months, which we're going through right now. So if the virus does begin to show signs of mutation during these trials, researchers are going to be able to respond by replacing or adding new targets into the vaccine. So really good concern. It's important to think about, but I have confidence in the scientists that are developing these vaccines that that's something they've taken into consideration.
Thank you, Doctor. Ellen in Oceanside and Paul in Del Mar both have a similar question. With so many people anxious for when they are going to be getting the stimulus payment, why isn't irs.gov, the website, more user-friendly for getting status updates? How will family status changes be accounted for, such as death of a taxpayer or birth of a child? Also, will there be an update when filing 2020 taxes for changes in status that occurred after the stimulus checks were issued? Well, my understanding, and we got this from the IRS, is that they are working on an improved website and a new portal. In fact, I think it's open at irs.gov, so I'd recommend taking another look. And what they told us is that everybody would be able to check their eligibility status. They could see whether they had their direct deposit information on the IRS website. They could see an estimated payment date. See where the payment's going to be sent, et cetera, such as we would expect from any modern website. As far as the specific information about family status changes in filing 2020 taxes and the changes there, my understanding is that those pieces of information would similarly be reflected on that new portal. Although if anybody has any questions or challenges with this, please contact our office. Again, we've got people that are ready, willing, and able to assist, and we'd be honored to do so. Ryan in Rancho Mission Viejo asks, is there anything you can do, meaning me, to make sure we reopen at an appropriate time that doesn't put people at risk? Well, as I said before, I understand everybody's frustration with the stay-at-home orders and closed businesses and closed public spaces. And I think we all want the same thing, which is to get back to normal as quickly as we can and as safely as we can. And the biggest thing that I can do, I believe, is on the testing side, because we know that really is the gate to get us through to where we're going to be able to have sufficient testing. Obviously there are decisions that are being made at the state level, at the local level, but where my federal jurisdiction comes in is with what we can do on a national testing strategy. That's why I've been pushing Secretary Azar, Vice President Pence, and others to really get specific and detailed plans in place to help the United States hit the metric that I just discussed of the 152 tests per 100,000 per day that we need in order to have sufficient testing. So we'll just keep at it. Here's a question for you, Doctor, from Stuart in Cardiff. What is the percent probability? Ooh, it's a math question. What is the percent probability of a false negative for a COVID-19 test when a person has the following symptoms? Low-grade fever for 3.5 weeks, tired and achy, tested negative for COVID, blood work all normal, some dizziness lately. Any ideas? I hope sounds like a pretty detailed hypothetical. I don't know if he's asking for himself or for a friend.
Well, that's a tough one. And there's two things that are going against me. One is I'm not a clinician. The other is I don't have a patient in front of me. So just going based on that, I don't think anybody would make a diagnosis based on that. But let me just say that, the probability of a false negative PCR test, that's the test that looks for the virus itself in a person who's actually infected, is low, but it's not zero. And there's a number of factors that can cause the test to come up negative. One of them is, how is the specimen collected? Normally it's done with a nasopharyngeal swab. They put the swab, which is sort of like a Q-tip, into the nose all the way back to the throat. It's not easy to do. It's not comfortable. And, if the person administering the test doesn't want to hurt the patient and they don't go deep enough, you might not actually pick up any of the virus on the swab. Also, sometimes they do the swab right through the mouth into the back of the throat, and it might also miss some of the virus that might be there. There could also be problems with the testing. So there could be the person who's administering the test might have some errors, and so you can end up with false negatives. And also the test itself is not 100% sensitive and specific, meaning that just by the design of the test, it will miss some positives. These tests are designed to be very, very sensitive so that they don't miss many of them, but there is always that possibility. And then finally, could have something to do with the timing of when the specimen was collected. It's possible that the person may have already been sort of beyond the initial phases of the disease, and now they have antibodies that have bound up what virus is there, and so it comes up negative on the test. So I'm sorry I don't have an answer for Stuart in terms of whether or not him or his friend has actually had coronavirus. I hope they did, and I hope that they're feeling better so that then they would presumably be immune. But yeah, false negatives can occur, and doesn't mean that the person doesn't have coronavirus, but it also could mean that they have something different.
3.5 weeks with a fever is a long time.
Yeah, it really is. It seems a little long even for coronavirus.
Do we know anything more about immunity since we last spoke? I know there's been some questions about that.
Yeah, I think it's a more and more important issue. The question is, if a person has had coronavirus and they have antibodies now, which will show up on the antibody test, are those antibodies protective? Will they neutralize the virus if a person gets reinfected from another person? And, by all counts, we expect that it should, because this virus should act like other viruses in that way. The question that we have, though, is how long does that immunity last? Is it a few months? Is it several years? And until we actually have more experience with the virus, we won't really know that. There has been this question of where people have tested negative and then they test positive again. And the question is, well, did the person ever really recover fully? Maybe they just had a reoccurrence of the same disease. Or was that test a false negative, like in the case of Stuart's question? So gotcha. Those are things that need to be investigated, but so far it doesn't look like there's overwhelming evidence that the immunity is not protective.
Got it. Another one for you from Marie in Encinitas. Many of us still wonder about future airline travel. I know I do. I can resemble that, especially for this summer. What about families traveling by car to state and national parks and to visit family and friends? And Marie would have no way of knowing this, but that was what we were hoping to do this summer, Doctor, is to go and visit some of our national parks. And I think we were going to do that in August, but that has been put on hold. But maybe not. Maybe it's okay to do.
Yeah. Well, it's kind of, to me, it's sort of like going to the beach. If you're out in the open air, you're getting some sunshine. You can maintain a reasonable distance from other people. These kinds of activities are pretty low risk. And if you are out camping and you have to go into the general store to go pick up some supplies or go get gas or whatever you're doing along the way while you're traveling, wearing a mask and using disinfectants and hand sanitizers are all ways that we can reduce the probability of infection. So that's that's my gestalt on that. But currently all non-essential travel is still strongly discouraged, especially with airline travel. The travel restrictions are likely to last through the end of the summer. Although aircraft, one of the things that people really worry about on an airplane is like the air that's circulating. And the good news is that from what I've learned is that aircraft actually have HEPA filtration in their air conditioning system. So they're not just circulating the same air around the plane, they're actually filtering anything out that might be in the air. So that's actually, that's really important. The other thing I've learned is that the airlines have always sanitized the inside of the cabin in between flights, but now they're doing even more to really make sure that they're disinfecting all the surfaces. I just heard that Southwest Airlines has taken all the reading materials out of the back of the seat pocket, except for the safety card. The flight crew are all wearing masks. They've eliminated onboard service, so no more food or peanuts or drinks, unfortunately. And get this, they have eliminated, or they are not selling the center seat in all the rows. So that way they can try to keep people further apart. So it's going to reduce the number of people on each flight, but it's a step in the right direction to sort of keep distance. But the fact that people they're not going to be serving any food, some advice to anybody that does need to fly like you, is eat before you get to the airport so that you're not hungry and you don't need to go, shop for food in the airport. I'm sure that the airport managers don't want to hear me say that, but that's one way to protect yourself, and then you're not hungry on the flight. Also, when you're on the flight, make sure you're trying not to touch surfaces, and if you are, disinfect your hands, don't touch your face. And it's not a bad idea for you to wear a mask yourself, somewhat to protect yourself, but also if it turns out that you are infected, you don't want to be the person who's spreading the virus on the flight to other people.
And I think it's mandatory now in at least a few of the airlines that you have to wear a mask, and that the flight personnel wear masks as well. I've been getting updates. I fly mostly United Airlines, sometimes Southwest, and both companies have been sending emails and just trying to reassure that the flights are safe. And I have read the same about air filtration. I still have been wearing masks though on the flights, and trying to be very, very careful. And I didn't really think those airline magazines were too sanitary to begin with. So I've tried to steer clear of those.
You're not going to miss them, huh?
No. I mean, when you see a crossword that's been done, like, and you see ketchup stains or whatever's on there, and I almost always I'll bring protein bars when I travel. And it's nothing against the food. It's just usually I'm the scheduling doesn't work out, and I'm too narrowly scheduled to have any time to get the food.
Yeah.
But I have noticed that most of the retail is closed at our local airports, or virtually all of it. The last time I was on, but I had thought we were going to go back next week. I was looking forward to that, and although wanting to do so safely, obviously, and the House physician, who is also a Navy admiral, said not so fast. The House needs to put in place protocols to ensure social distancing, not only during votes but also in committees and meetings, etc. And hopefully that will be done very, very quickly. Because I think we're already willing and able, for those of us that are, younger, not as young as I once was, but, we're ready, willing, and able to go. And I think we're going to do the people's business, whether we have to do it remotely or we do it in person. But I think we're eager to move forward on this next CARES 2. So we'll do so safely. Here's a question from Julian in Dana Point for you, Doctor. Recent studies in Korea involving call center workers show that the greatest risk of transmission of the virus is from droplets from infected people in large numbers at close quarters in confined spaces. This would seem to apply equally to sitting on an airplane for 5 or 6 hours. What advice would you give those? So we just answered this question.
Yeah.
What advice would you give to those who, like Mike, have no alternative but to fly across the country? Oh, man.
Yeah.
We talked about this.
Yeah, I think so. I think, the other thing I didn't mention was, the time that you're in the terminal waiting for your flight. And I haven't been to the airport. You have, maybe you could comment on it.
Yeah.
I know that the airlines are making an effort to distance people out. So when rather than crowding the gateway when it's time to board the plane, they're having people spread out, which I think is good. I think they're trying to minimize the amount of touching of surfaces. So maybe not putting your phone up onto the podium to, register your ticket.
Or you actually, you put your phone up there. They don't touch anything.
They don't touch it. Yeah.
They have you do that. Yep. Yeah, it's interesting. So when you get to the airport now, there's a plexiglass between you and the TSA. Mm-hmm. They ask you to just put your mask down just for a second so they can see that it's you.
Yeah, that's good.
They bring you through very quickly, and then you go through the standard baggage screening and all of that. Clean, and they always, I bring my jumbo thing of wipes, so they usually will pull that aside and, what the heck are you doing with this big thing of wipes? But they let me through with it. And then, at the gate itself, you're right, everybody's spread out. I have seen, in some places where they actually have social distancing, like stickers on the ground. Mm-hmm. For every 6 feet, they'll put a little sticker and, stand here. We've seen that in other businesses as well. I think we're probably going to see more and more of that. And then you have your own phone that you use as the
ticket.
The ticket, exactly. And then on the plane itself, they really spread us out quite a bit. The last plane that I was on, there was maybe 20 people on the plane, and probably 8 of them were members of Congress.
Wow.
So nobody else was flying, direct from DC. But we'll just do the best we can.
Yeah. Hey, Mike, another point that I want to make on that is, thinking about myself, going to the airport, going through security, handling my baggage, touching things, getting to the gate. What I would do in that case is, I know my hands are potentially getting contaminated with virus. I just assume that they are. So if I'm wearing a mask, I want to make sure that I'm not trying to adjust it. Now, I understand I have to pull it down for security, but then I'm going to put it back up. But think about how you're doing that. Try not to touch it too much.
You do it from the side.
Yeah. And then, avoid touching your mask as much as possible, and don't touch your eyes, because all that can be contaminated. There you go. Cover your nose.
Cover your nose.
There you go. It's all got to be covered. And then, when you get in, hopefully you have some hand sanitizer, or they have a hand sanitizer station. Clean your hands, or go to the bathroom and wash your hands. That's key. Just, try to be really cognizant of the fact that if you're touching stuff, your hands are going to get contaminated. Don't touch your face until you have a chance to wash your hands.
Well, I have my aforementioned gigantic thing of disinfectant wipes with me that I, try not to go through all of them because they're in short supply, but, certainly make sure that anything that I'm touching. Ironically, the place where I had the most concern was at Dulles Airport in Washington. They have the people movers that take you from the main terminal to the gates. Uh-huh. And they, maybe a month or two ago, they didn't really have any social distancing at all on those. So the thing was absolutely crowded. And this past time, they'd, start separating us out a little bit better on that. But little by little. Nanette, what's that?
We're all learning.
We're all learning, exactly. No, and my hat's off to everybody working at our airports and flying the planes, and just amazing people. Nanette in Oceanside asks, how can we rescue the food going to waste on the farms and get it to the people in need? That is an excellent question, Nanette, and that is something that many of my colleagues and I are very concerned with. What we have been told by the U.S. Department of Agriculture for months now is that we don't have a food supply problem. We have a food distribution problem. We've seen, of course, stories now of, different plants in different states where we've seen outbreaks of COVID-19. And, unfortunately, we know that more problems will come unless we get very smart about testing again. And that's the same with our prisons. It's the same with our nursing homes. We just need a lot of testing. And I've been in close contact with our local food banks. I think they're doing just fine with regard to food supply. Obviously, we're all very concerned, and the House Agriculture Committee and the chairman, Colin Peterson from Minnesota, has been providing us with regular updates each week. And we're monitoring the situation very, very closely, but very concerned. Sandra Ellen in Encinitas asks, last week, the doctor, that would be you, doctor, mentioned that hospitals in short supply of protective masks were putting them in paper bags and letting them sit for several days so they were safe to reuse. We're all short of masks, but several of us have a few paper masks. Can we safely put them in the sun for 4 days or in a bag for a period of time and reuse? We also heard that vacuum cleaner HEPA bags were a good filter to place in masks sandwiched between the cotton masks. Is there any danger of microscopic glass fibers that are harmful if inhaled?
Sounds dangerous. Well, there's a few things there that I need to sort of unpack. So one is the question of reusing a paper mask. They're not designed for reuse. You should avoid reusing them. The only time that they've been recommended to be reused is in the case of healthcare settings when there really is no other option. And in that case, the CDC has said that if you put a mask into a paper bag for about 5 days, you have 5 masks and 5 bags, and you rotate through them so that each mask is put aside for about 5 days. That should be long enough for the virus to die. But this is like really, really, desperate situations. It's nothing that you would want to do. It's nothing that you'd want to mess with. In terms of the sun, the ultraviolet light has been shown to be effective at decontaminating masks. However, that's only recommended if it's being done in a facility that has the proper UV light and the proper amount of time that the masks stay in it and that the mask is fully exposed. Trying to do this outside in the sunshine there's no reliable evidence that this would be effective. I mean, ultraviolet light does kill the virus, but depending on whether or not it's a very sunny day versus a cloudy day and whether or not there's shadows, could really affect the effectiveness of this. So it's not recommended. Better off, keep those paper masks for when you absolutely need one, but in the meantime, make a cloth mask that you can throw into the wash every day and just reuse it. It's a better option. It'll work just fine. And you can launder them with the rest of your laundry. You don't have to wash them separately, and just a normal wash will work just fine. And then with the question about the vacuum cleaner bags, the HEPA bags, they're designed to prevent small particles from coming out of the vacuum cleaner when you're using a shop vac. And so they should, filter out very fine particles like viruses. However, I don't know what the bags are made out of. I don't know if they do have glass particles in them. So I can't say whether or not it's safe to use them in a mask. I can tell you that the mask that my wife made, where she took 2 layers of tea towel and we tried to use that as a mask, it was actually hard to breathe through. And so I'm wondering, I'd be a little concerned that if you try to add a HEPA filter in between, 2 layers of fabric, it might also be really hard to breathe through, in which case you're going to have a tendency to want to take it off. And so it might actually be counterproductive. I could also say that the company that makes those vacuum cleaner bags, Shop Vac, had a big warning label on their website that said, "We do not encourage you to use our filters for face masks." Now, I'm sure that was for liability reasons, but they're telling people not to do it.
Sounds like the Lysol manufacturer.
Don't drink the
Which,
stuff.
yes, don't drink Lysol. If you missed last week's show, don't forget, don't drink Lysol or inject it. Not a good idea. Teresa in Encinitas asks, Facebook leadership has said they will take down posts that publicize protests against shelter-in-place public health orders. Many of us have lodged complaints with Facebook regarding posts publicizing these events. There are endless events posted now throughout California, and repeatedly get the response that Facebook understands our concerns. However, the events don't fit their criteria that calls for pulling the post. How do we confront Facebook for not fulfilling this assurance? Well, I can guarantee you that Facebook has had a great deal of scrutiny from Congress, and it will continue to on a go-forward basis as it regards its policies around political communication. My personal belief is that we have to stick to the experts. We have to stick to the science and data and allow our decisions to be driven by data. And the more that we can get good information out there, including on Facebook, the better off we'll all be, which is why now for a number of weeks, we've had Dr. Garfien on Facebook. So hopefully, somebody is scrolling through their Facebook in our local community. They have just as much likelihood to see Dr. Garfien and to listen to what he has to say as they do to hear somebody wanting to inject Lysol. But, what they'll actually do with all that information is something altogether different. And the great hope is that people will listen to the facts and the science and data and allow that to guide their decision making. And that includes the stay-at-home order. There's a lot of heated rhetoric out there, and I am one of those that believes we've got to be driven by the data and driven by science. That's why Dr. Garfien's here, and he's good enough to keep coming back. Amy asks, is it possible to reverse the deduction extremely wealthy Americans will receive at the expense of taxpayers via the CARES Act? Well, this was something in the CARES Act that obviously I disagreed with and disagree with. And I've said as many times as possible that the CARES Act was far from perfect. There were significant problems with that bill. Anytime you have a $2 trillion bill and you have every member of Congress that votes, with one exception, to pass it, there's no question in my mind that there'll be problems with the bill. And there were. This was one of them. I think that at the end of the day, the idea behind the CARES Act was that workers, families, small businesses, those truly needy, and yes, a handful of larger businesses like airlines, like Boeing and certain others that desperately needed assistance would get it. For the larger businesses, though, guardrails, specifically around executive compensation, stock buybacks, and the rest. And for the smaller businesses, the idea was to help them weather the storm. It was not intended that the wealthy get tax deductions. But my great hope is that on a go-forward basis, one of the things we can continue to talk about is reversing some of the more punitive parts of the 2017 tax plan, including the state and local tax deduction cap of $10,000, which I have been very opposed to for since it came into effect, which we passed the repeal of that in the House before COVID-19. And we continue to talk about that as part of CARES 2, although there is significant pushback from Mitch McConnell and from Senate Republicans to repealing that $10,000 cap. There'll be a huge relief to many of the families in the 49th district. 43% of our district takes the state and local tax deduction. On average, deducts $24,900. And when the cap was put at $10,000, it hurt a lot of people in our district, and not just wealthy people, but lots of middle-class people. 86,000 people in our district making less than $100,000 take the state and local tax deductions. So I'm going to keep working on that. Question for Dr. Garfien from Adele in Solana Beach. Does the medical community have an opinion about the relative safety of non-cooked takeout, for example, salad or sushi, compared with cooked food? And as a lover of sushi, I really hope that the answer is that there's no difference.
Oh, you're in luck, Mike.
That's excellent. That's excellent news.
Yeah, I mean, I keep reading up on the WHO and the CDC's website looking for some evidence that there is an increased risk, but so far it doesn't look like there's been transmissions from food. So there's currently no evidence to suggest that the coronavirus is transmitted through food. And unlike the norovirus, which is what we always hear being associated with, gastrointestinal disease, the coronavirus doesn't live on food surfaces for an extended period of time. Also, because the virus doesn't grow in food, the amount of virus that's initially placed on food by somebody's dirty hands or a sneeze or a cough would dwindle over a short period of time. So the amount of virus is constantly decreasing. It doesn't grow like a bacteria would on food. And so normal cooking policies and hygiene standards that are already in place to combat foodborne illnesses would do the same, have the same effect on coronavirus. So, if people are being careful in the restaurants and the kitchens to avoid contaminating it with anything else that could actually really cause bad foodborne illnesses, it should protect you from coronavirus. Just a couple of things to keep in mind is that when you do get your food home from the restaurant, discard the outside containers, maybe transfer the food to a clean plate so that the things that might have been touched by people who have dirty hands would be taken care of. And then also, wash your own hands when you're done, preparing the food and before you eat to make sure that you're not contaminated with anything that might have got on your hands from the outside of the containers.
Thank you, and that is great news. I will tell my wife. I'm sure she will be very happy to hear about this. Barbara in Oceanside asks, I'm hearing from a relative in Nebraska that the pork and beef plant workers in Nebraska and South Dakota are mostly migrant workers who are all sick and without health care. I'm sure the situation is the same at other food processing facilities and farms in California and across the country. What is being done for these migrant communities to help protect them and treat them, and also to protect others from the virus spreading from these communities? Well, first of all, I am incredibly grateful for the work of our agricultural workers. Very easy to take for granted their sacrifices on the front lines of this. And we've seen truly in the last week some very, very difficult, troubling stories from a number of states with regard to pork and beef processing facilities. My great hope is that we can overcome the challenges to our food supply with two things. Number one, PPE. We have to make sure that our food service workers, that are those in plants across the country, have access to personal protective equipment. And that's why we have written FEMA and the Vice President and others demanding transparency and accountability on PPE. Again, we've sent them tons of money for PPE. We have to make sure the PPE goes to the front lines where it's needed. It means our frontline health professionals, and it means others that need it the most, whether it be in whatever hotspots exist. And we now see those three types of hotspots with prisons, with nursing homes, and with our food plants. So second, testing, and testing. We know how many tests we need to run. We know where we need to run them. Now all we lack is the political will for the federal government to work with the states and cities to help manage the supply chain for reagents and for swabs. If we get all that done, I'm confident that we can get this under control, including at those facilities that you mentioned. Here's a question for Dr. Garfien from Sam in San Diego. Sam says, I'm losing patience with people throwing shade on what's necessary for our public and personal safety to avoid getting the coronavirus. What are we getting wrong in our public health and public safety messaging that continues to trigger noncompliance among individuals in so many neighborhoods?
Yeah, that's a really good question. I mean, that's something that a lot of people go to school to learn how to do, is to develop public health messaging and then evaluate them, and still always trying to do a better job of it. This is tough. Throughout the country, there's been a vocal minority of people that are really protesting the stay-at-home orders. They claim that an immediate return to work is necessary to save their jobs and their personal interests. Others believe that the virus is a hoax created by the media to allow the government to overexert its control over individual rights. But what we have to keep in mind is that the goal of the stay-at-home order is to reduce transmission within our local communities as well as between communities. If people start traveling again, they could bring the virus back into their community. And I think one of the things that's really frustrating is, if nobody in your neighborhood's got coronavirus and you think, well, why can't I talk to my neighbor, or why can't I let my kids play? Nobody here's got it. But as soon as people start spreading out and they go visit a relative or they go back to work and then they bring it back in the neighborhood, now all of a sudden it's there. And if people are not practicing good practices, it's going to spread quickly. So we have to keep that in mind. I think a big problem here, addressing this question, is that there's just a lot of mixed messages that are coming out of the administration and even the science community to some extent. I think that the science community is trying to do the best that they can with the available evidence. And what we found is that, what we thought based on our experience with other diseases sometimes holds up with coronavirus. Sometimes it's a little bit different. And so we have to modify our messaging as new evidence comes out. I think the administration has been, frankly, very harmful in, sending out a lot of messages that are inaccurate. They're not based on science. They're based on, politics and other issues. And I think people get really frustrated by that. And frankly, I think that, people will listen to the news and they'll read the paper and they'll pick out the messages that resonate with what they want to do. And then that's what they listen to. And so having a lot of these different messages out there is creating a lot of problems for people. And it's allowing people to say, well, I'm not listening to you because I heard something different and I like this other message better. So I think in terms of our response, the more that we could do to synchronize our messaging and get that messaging out there based on science, the better. And then so in terms of regarding what we could do about better messaging, in my opinion, I think what we need to do is we need to show empathy for the people that are hurting financially, emotionally, physically from COVID. It's really hard. And I think we need to encourage them to help to find solutions to reopening society. So rather than spending their time making signs and protesting and fighting, say, look, we've got this problem. We've got a virus that we're fighting against. Help us to figure out what would you do in the case of reopening your business to make sure that your employees aren't getting infected and they're not infecting other people in your business. Help to come up with those solutions, put those solutions forward, and we can all sort of work on solving the problem together instead of it being like, you're wrong and I'm right, and so I don't want to follow your rules because they're wrong. It's like, no, let's all work together on this. So in terms of that messaging, I think that's what I hope that we can sort of get across to people, is that this is all new. We're all sort of learning about what to do. We want to base it on the best science. And if you want to open your business, help us figure out how to do that safely. That's what's going to get us there, not a protest, not a fight. That's not going to be helpful.
Doctor, what do you say you may not have any specific messaging on this, but what do you say to people who are young and healthy? That's something I've wondered myself. It's tricky because they feel they're not at risk. They feel there's the Superman complex that I think we all go through at a certain age, and until we learn better.
Absolutely.
What do you say?
I've thought that myself. It's like, it's like the flu. I'll take it for a week if I could just go back to doing what I was doing before.
Yeah.
I think that two things. One is that it has killed young people. So they're not completely invulnerable. Although the risk is low and, young people die of other things like car crashes and things as well. So that might just be a risk that they're willing to take. But I think the other thing is that they're part of the community. And if they get infected and they don't know that they're infected and they're spreading the virus without realizing it, that could end up infecting somebody's grandmother or, somebody in the community, maybe that person that's working at the store who unfortunately is, old enough to get really sick but too young to retire, and they're at that store and they're going to get exposed when you come in. So I think we have to be careful about being a little too cavalier about, it's okay if I get infected because you're part of the community. And eventually it's going to spread to people that really are vulnerable, and we have to do our part.
Thank you for that. Anne in Vista asks, could addressing climate change be folded into an infrastructure bill? Well, absolutely, I think it could. And I think it needs to be. Before all this, the House had proposed a $760 billion infrastructure package called the Moving Forward package, and it includes tens of billions of dollars in investments in the electric grid of the future, in creating a network nationwide for advanced transportation, electric vehicles, for dramatically reducing our dependence on fossil fuels. And I think that infrastructure bill has a great deal of merit, and that was before COVID-19. We also know that proposal would put millions of Americans to work, building 21st century, not just electric infrastructure, but water, transportation, and broadband. From our prior discussion, we know the importance of connectivity now more than ever, where we're being asked to work from home and study from home and see our families and loved ones from home using the internet. 21.3 million Americans have no access to the internet today. And that's a stunning number, and one that we've got to address, and we've got to do it quickly. We have to, I believe, bridge whatever digital divide is left in the United States right away. And we have an opportunity to do it and put millions of people to work in the process. So my great hope is that one thing that we are learning is that public policy needs to be driven by data and needs to be driven by science. That's how we're going to get through this pandemic. That's how we're going to put the economy back on positive footing. Just the same, I would hope that we would address climate change by focusing on data and focusing on science. And we have a different curve with regard to climate change than we do with regard to COVID. COVID, we know that if we take those steps, we'll dramatically reduce that curve. I was on a call earlier today with one of our local elected officials who reminded us that for climate change, the curve continues to increase. And when we reduce greenhouse gas emissions, but not so far as to dramatically do so, that curve continues to increase. So we've got a lot of work to do with regard to climate change. That's a crisis that's going to be on the front burner for me for as long as I'm in office. We've got to get through this near-term issue with coronavirus. And my great hope is that as part of CARES 2, we can include a bold infrastructure package that, yes, will do many different things, prioritizing the economic growth that it will create, the millions of jobs it will create, but yes, also something that will be good for our environment. And we should not be allowing big polluters to use the pandemic to undermine decades of bipartisan environmental protection. And that's something where we've got to draw the line and stand up against that. And that's what I have done, and that's what I'll continue to do. So with that, lots of questions, and we're just about out of time. And I wanted to turn it to you, Dr. Garfien, for any closing thoughts or comments you might have this week.
Well, sure. So this is a big week for me, being able to get back in the ocean. It felt wonderful. I know a lot of people have been down at the beach looking at the phosphorescent tide. It's been really spectacular. I was at the beach at midnight, believe it or not, driving by, and I couldn't believe how many people were parked on the side of the road at Torrey Pines State Beach trying to watch it. And I think that's been a challenge for the police and the lifeguards. So if you're doing that, do it safely, wear your mask, and try not to gather. But the beaches are open now for swimming, surfing, kayaking, and walking, but gathering on the beaches and beach sports are still prohibited. According to the Union Tribune, Del Mar and Solana Beach are going to reopen their beaches on Monday. And then Carlsbad expects to do the same on Monday as well, based on the state. But if the state beaches don't reopen, they're going to wait up in Carlsbad as well. I'm not sure what's happening in Orange County. Maybe you can comment on that, Mike.
It's been difficult, is what's happening.
Yeah, we've seen some of the protests.
Yeah.
But the thing that I really want to emphasize here is that in order to keep the beaches open for the limited activities, we need to really abide by the health department regulations. I think that most people would agree that the activities that I'm talking about like surfing and swimming and kayaking, are going to be safe. They're not likely to cause transmission of coronavirus. But those other activities like picnicking, playing sports, hanging out on the beach, laying out and gathering with friends, is really going to impinge on the physical distancing and increase the risk of spread of coronavirus. So, one could argue that, hey, I'm just sitting here on the beach with my family. But when everybody's sitting on the beach with their family, it's going to be really hard for the lifeguards to be able to know, like, who's a family pod and who's actually a bunch of friends gathering. And so if you start to force them into that position where they're now sort of having to figure out what's safe and what's not safe, they're going to go back to just closing all the beaches again. They're going to say, this is out of control. We can't control it. We've got to shut it down. So we're getting back some of these privileges or rights that we've been wanting for a long time. We want to be able to preserve those and then slowly sort of get more and more back to normal. I think if people are responsible and do what's allowed and not try to push it too far, we're going to be able to continue going to the beach. I think if people are overly aggressive and take that opportunity to just, rush the beach and disregard all of what we've been trying to practice over the last 2 months, I think we're going to be backtracking. So I really hope that people will, do the right thing, continue to wear your masks, continue your social distancing, take advantage of the opportunities that you have to get outside and enjoy it, and even visit with neighbors, but at a respectable distance. That those kinds of things are safe, and I think that will help us all to feel a little bit more comfortable. Just don't go crazy, until we get a better handle on the epidemic.
Thank you so much for that. I wanted to take just a moment and again say thank you to the frontline workers, many of whom tune in to these weekly town halls for their incredible courage, for their selflessness, for putting their lives on the line every single day to keep us safe, to keep our country moving forward during these difficult times. That includes our healthcare workers, our doctors, our nurses, home care providers, paramedics, law enforcement officers, firefighters, grocery workers, truck drivers, delivery workers, postal workers, infrastructure, utility, and building trades workers, sanitation workers, janitors, social workers, airport workers, TSA agents, farm workers, county workers, government employees, and all of our other essential heroes here in the 49th District and across America. And we're going to do everything we can in this next federal effort to stand up and to fight for you, to try to give back to those who are our heroes, who are doing so much in the face of this unprecedented crisis for our country. I think it's absolutely critical that we follow the science and the data, both as we create good public policy and as we try to make good personal decisions. We all want the same thing, which is to get back to as normal as we can, as quickly as we can, and as safely as we can. And I would just, again, advise everyone watching, listening, whether on Facebook or Twitter or YouTube or on our website, read up on those guidelines, follow them to the best of your ability. Let's keep each other safe. Let's be responsible. Let's also continue to act in a spirit of kindness and generosity and decency. I know we're going to get through this one day at a time. I know many of us are going a little bit stir crazy, and we're doing the best that we can in a very, very difficult situation. For those who have lost their jobs, their livelihoods, or have lost loved ones in this, I'm incredibly sorry for the hardship that you're experiencing. Know that we are trying to do everything we can at the federal level to be of service and to help. Again, we've got to address both the public health crisis and the economic crisis, and that's what we're all trying to do each and every day. So thank you again for tuning in. I'm grateful to my incredible team, our wonderful staff, our great campaign manager, Adam, Ellen Montanari, who works so hard on these town halls every week, Eric, our wonderful communications director, Hunter, who sets up so many Zoom meetings every single week, and Jeremy, who does such a wonderful job helping us with these video conferencing town halls. I'm very, very grateful to our wonderful team. Grateful also to my family, my great kids, Jonathan, Elizabeth, who are distance learning. and really have just shown an amazing ability to adapt to a very difficult circumstance. And the love of my life, Chrissy, thank you so much for standing by me every single day. Thanks for watching, everybody. We'll see you again next Saturday afternoon.